Good afternoon, everyone. I am Dr. Balaraju Naidu. Thank you all the delegates for joining this webinar. So today topic for discussion is total knee replacement surgery. So total knee replacement surgery is a surgical procedure where we replace the damaged part of the cartilage. If you look at this model, this is the normal knee joint. Everybody will have smooth cartilage like this. So in the knee replacement surgery, we replace this bluish cartilage, which is damaged one, which is like completely damaged like this, the red part, with a steel implant. One side we do metal. You see here, one side metal knee replacement, one side plastic we keep it. This is known as total knee replacement surgery. And there are 4 stages in the knee arthritis. You look at this model. This patient has a normal X-ray. Till everyone will have 40 years of age, a normal knee X-ray. Patellofemoral arthritis also normal. And in the early arthritis, like 45 to 50 years, the patient starts, the gap between the two bones starts reducing. In moderate arthritis, 55 to 60 years old, so bone touching each other, it starts generating the pain. In advanced arthritis, completely joint gap completely decreased and patient experiencing severe pain, not able to sleep in the night, not able to go to market and buy vegetables, not able to do daily living activities like going to washroom is also painful. If you look at this muscle, last one, VMO, this is the muscle last developed in the evolution. So this muscle gets weak in the knee pain. So certain patients also have ACL ligament tear. If they neglect it, then the cartilage defects will start, like it is known as osteochondritis dissecans, OCD knee. So for this patient, there are various causes. First, number one reason is osteoarthritis, which is like age related. Second one is rheumatoid arthritis, which is like, genetic problem. And there is a history of rheumatoid arthritis in the father or mother. They may tend to get in their children also. So the third reason is post-traumatic. Already patients underwent some surgery, but unfortunately within span of 10 to 20 years, they may develop arthritis if proper weight or properly fixed surgery not fixed. So symptoms, patient will have chronic pain in the knee joint, difficulty in taking, climbing upstairs and downstairs, and stiffness and swelling in the knee joint, and reduced quality of life. Patients will experience severe pain in the night especially. They even going to washroom or getting a glass of water from the kitchen is also very difficult. So these patients we recommend knee replacement surgery. And when is knee replacement surgery is recommended? Usually, first we try for non-surgical methods like pain medication, physiotherapy. Certain patients even we give knee injections like PRP, lubricant injections. And last stage is the knee replacement surgery is the patient demanding procedure, means patient should urge for the surgery. Then only we give this injection. And it affects pain affects badly the daily living activities like going to washroom, going to market and buying vegetables also affects. There is a clear structural damage visible on the X-ray, even on MRI. So patients suffering with arthritis, stage 4, we do this. So there are different kinds of knee replacements available. Partial knee replacement means only one side we replace the knee. Then total knee replacement surgery, where we replace the complete damaged cartilage with a new implant. And there are 3 types of surgeries: conventional surgery, navigation surgery, and robotic surgery. So today I am going to discuss only in detail about robotic knee replacement surgery. So robotic means exactly which has very high precision, faster recovery, reduced pain, improved implant alignment when compared to traditional surgeries. And if you look at this model, you'll come to know exactly what is the robotic knee replacement surgery. See, this is the stage 4 arthritis, completely damaged joint. We replace with this with steel implant one side and the other side plastic. We generate a 3D model using a J-planar software. You can see here 360 degrees. I can check whether the implant positioned properly or not. This is only possible with the help of robotics. This is the intraoperative imaging. I can reconfirm whether the implant is there or not. This is the robotic surgery where, automated robotic surgery. We write the program and the patient will be closely monitored by the surgeon. This is also known as interactive robotic surgery. Most of the patients interact with me while doing the surgery. Even slight movement or increased abdominal pressure like cough, sneezing also robot will stop. Many patients ask me whether robots make a mistake or not. I say robots will not make a mistake because they are accurately designed. It will be under surgeon control. And most of the patients enjoy during this surgery by watching it their knee replacement surgery. And the beauty of knee replacement surgery is patients will walk like this. You see, these patients all came in wheelchair to me before surgery. Within 15 days, 20 days, they are walking comfortably without any pain. And with the help of robotics only, we will able to replace normal kinematics of the knee patient, whatever they had in their 40 years. So this patient came from Vijayawada. I did a both knee joints. So this is all about surgery. We do preoperative planning, then properly remove the damaged cartilage, and then place a metal implant, and then post-operatively we give good physiotherapy. And benefits of total knee replacement surgery is completely pain relief, very good, improved mobility, better joint function, enhanced quality of life, also very good. So, so many patients ask me whether robotic joint replacements are require physiotherapy. It is only 10 to 15 days are required because make sure that physiotherapist will be attending to you and make sure that they will be properly guiding you to take care of taking steps or using toilets, all that. So thank you all for this joining. And if any questions are there, you can come back to us. Thank you once again. Thank you all.